Everyone, this is Dr. Ben Thompson. Welcome to my podcast. Today we have two special guests. We have George Leidig, who is a medical doctor, and we have Dr. Ed Farrar as well, another medical doctor coming from England. Gentlemen, please introduce yourself and tell us about Odo, or as you may say, Auto, the app for tinnitus and the applications and why someone may be interested in learning more about that. Dr. Ed, I'll pass it to you.
Thanks, Ben. Well, firstly, thank you for having us. It's great to be on the podcast. So George and I went to medical school together. In final year of university, George joined the Navy, I joined the Royal Air Force, and the original plan for us was to train as doctors in the military. George at that time actually developed tinnitus himself, which was fairly unpleasant, I think, for you, and went on, finished medical school. And the original plan for me was actually to train to become a surgeon. But it was during our time in the military that George and I saw a large number of men and women with severe tinnitus, and sort of sat down and realized, okay, there's a big problem here. If you have tinnitus, it's very difficult to access any kind of help. And it was sort of at this point that we'd both become somewhat disillusioned with our careers as doctors. And we thought, okay, we've got an opportunity to use the skills we've learned as doctors and in the military to create a digital solution for tinnitus.
And George, tell us about the app, tell us what it does and why someone with tinnitus may be interested. There's many apps, there's many different sound therapy types. So what is the app doing very well for your users?
Yeah, for sure. So Otto is essentially the whole point of Otto is to improve access to psychological therapy for tinnitus. And that was based off some research guidelines that came out at the beginning of last year, essentially saying that the only real kind of proven treatment for tinnitus and tinnitus associated distress is psychological therapy. So as Ed said, in our work, like seeing our patients, it was very difficult to access their therapy. And we just thought maybe if we digitized it and put it in an app that anyone could access sort of straight off their phone, then maybe we could, provide a lot of relief to the many people out there with tinnitus. So in its purest form, it's essentially a repository of psychological therapy for tinnitus, mainly CBT, but lots of other little bits and bobs as well, educational stuff, relaxation, mindfulness, and so on. And then, of course, there are the other sound therapy features that we've built in. So your kind of standard sound library with like curated sounds and masks for people to help with sleep and so on. And then over the last few months, we've built in some slightly more technical features like notching and boosting, where we can capture the sound of the person's tinnitus frequency and modify the sound accordingly. So we launched in January and we've had a really good response so far. I think we've delivered just over 50,000 therapy sessions now. And we've had hundreds of thousands, if not millions of sound minutes delivered to our users. And the feedback's been really good. It's constantly work in progress. We're always adding new things and changing things up and adding new features. But it's a really fun, exciting project, and I feel like we're doing some good for sure.
Absolutely, and I have patients who have worked with you all and who have worked with your app, Odo, and I'm an American, so I'll always say Odo, because when we go to audiology school, we learn about the different parts of the ear, and we say, Odo, otosclerosis, for example, it's an ear condition, and you guys know that. I've had patients who have used the app who use it to have some extra complementary psychological, self-guided self-help and sound therapy all in one. You have a nice presentation, a nice educational presentation with some data. I would love for you to share your screen and talk us through what kind of insights you're getting, because this can help professionals, this can help users, this can help someone with tinnitus understand how can an app, how can technology, how can sound therapy, how can self-help psychology treatments be used. So please take it away.
Yeah, absolutely. Yeah. So we're quite meticulous with the sort of data we collect. In fact, I'll start with something a little bit simpler. So this is probably a good overview of the sound therapy that Otto provides. This chart here just really shows a breakdown of our most favorite or the most listened to masks, the top three of which, white, brown, and ocean, are sort of relatively high frequency, high pitched masks, which matches up with some of the data I'll show you later about the nature of the user's tinnitus that we're able to collect. We do find that we have more male users than female users, and that this age bracket, the 45 to 54, tends to be our most heavily sort of engaged demographic. And one of the other things we find interesting is actually the time of day that people engage with the app. So this is just a chart showing the time at which people are engaging with Otto. And it's similar for sound therapy it is for actual talking therapy. And I always found that interesting, actually, because, sort of, I suppose, if I was to refer somebody to a therapist as a doctor, like this for face-to-face therapy, then they might find they have an appointment around here. But actually, you can see that most people like to engage after working hours, essentially, right? Which is why digital solutions or telehealth solutions, I think, will be essentially to provide a better experience for the patient or the user. So this is one of the most sort of interesting slides, I think. I'll just switch the age up there, it's slightly confusing. But essentially, we've got here about just over 1,000 tinnitus profiles. So one of the things Otto can do is it can allow you to match your tinnitus, both sort of frequency and a rough estimation of volume. It's probably worth caveating here that the tinnitus volume itself is there's no absolute measure of how to say how loud someone's volume is, but relative to the last time we measured it on the app, it should be relatively consistent. But there's an interesting disparity between male and female. So we find that generally males have a slightly higher tinnitus frequency. So it's higher pitched in males than it is in females. And also it's higher pitched the younger you are. And as we get a little bit older, the tinnitus frequency seems to drop off slightly. So I think these insights are relatively new. I'm not sure that, well, I know that, tinnitus frequencies and so on have been measured in the past in studies, but not quite at the scale that we're able to do so with Otto. There are other kind of websites and apps and stuff out there that have vaguely similar data sets, but again, this kind of scale of ours that we're able to build up quite quickly is really interesting for us.
Yeah. I made a video about measuring tinnitus frequency, measuring the pitch of your tinnitus, and people enjoy to validate their experience, right? But there's also a lot of comments of, okay, so now what? Why did you make me measure my tinnitus pitch? What do I do with it? And that's an interesting question, because measuring tinnitus so specifically, it can validate the experience, but does it really affect the treatment, whether that's sound therapy, psychological treatment? Usually not. So I'm curious, the data that you guys are collecting, which of that data are you using to improve your app, to enhance your user experience, or potentially to understand more of the data analytics and the research element of what can we do to make things better, easier for tinnitus patients?
Yeah, there are probably two main functions that we get out of collecting someone's tinnitus information. The first one is to provide tailored sound therapy. So if we know that you have a high-pitched tinnitus, we can provide you with a high-pitched mask, or even we can just take a normal mask, maybe of a really complicated environmental scene, and amplify the elements of it that are similar in nature to your tinnitus. And the aim of that is to provide a more effective masking tool, right? So if you're trying to get to sleep and you're something to distract from the sound of your tinnitus, the idea is that something that's actually matched will be more effective. You're completely right that the evidence is still inconclusive. There's still lots of active research going on. It's an interesting topic, and there are lots of fancy things people are doing with sound therapy. But we've taken a fairly simple approach at the moment, which is either notching or boosting the sounds that we play. The other thing we do, we just allow people to share the tinnitus sound, right? To show other people what it sounds like. And that's like a massively valuable thing. Like people with tinnitus, it's such you really do have to ironically suffer in silence, right? Like it's very difficult to explain what it's like. And if you just tell someone it's like a high pitch ringing, well, fine. But like the variety of what that means to people is so different. So being able to pinpoint somebody's tinnitus frequency and allow them to play it back either to a physician or to their friends or to a therapist or whatever is massively valuable to our users. And one of the other sort of main points, really.
Thank you. Ed, let's bring you into this. Let's talk about the people. Let's talk about the human experience of how an individual using your app benefits. What is the real world benefit of having psychological, the self-help therapies, of using sound therapy? What kind of feedback have you guys gotten from your users?
Yeah, so of course, the aim of tinnitus therapy or tinnitus treatment is habituation. So as I'm sure many of your listeners will know, habituation is the point whereby you still hear the tinnitus, you don't notice it like you used to, and the sound doesn't distress you. It's not as unpleasant like it was when you first started hearing it. So of course, the aim of the psychological therapy is to speed up that point. And habituation can take, if you're lucky, can take months. If you're unlucky, can take years. And we've designed the app and the therapy. Lily has designed the therapy content with habituation in mind. And actually the first therapy session explains what habituation is. So with that, we've sort of the therapy program will teach users the skills they need to habituate and to rewire their brain to react differently to the tinnitus. And that's sort of from what we're doing with the perspective of the psychological therapy. With the sound therapy, we really encourage people to work out what works best for them. Tinnitus is a really, really subjective experience, very personal experience, and what works for some people won't work for others. And that's something we really encourage people to do alongside the therapy program that's offered with the CPT and other therapeutic techniques.
And do you find that most individuals, maybe you are or are not asking this, do you find that most individuals are coming to you as a complementary to seeing their doctor, seeing their audiologist, maybe working with a therapist?
So it actually varies. We've had really good feedback from people doing both. So certainly in the UK, therapy is really, really difficult to access. The waiting lists, if you're unlucky, you could be waiting over a year to see a therapist. So we found that people that aren't able to afford face-to-face therapy and are stuck on a waiting list have found they've had a really, really good result from using Otto just on their own, and they've had, it is helping them to reach habituation. Conversely, people that have been or clinics, so patients that have been using Otto in conjunction with their therapist or in conjunction with a healthcare professional have also had really good results. So Otto is being used. We've partnered with a number of independent clinics, both here in the UK and in the US, that offer varying levels of tinnitus management. So some of the clinics will offer, they won't offer tinnitus therapy in-house, but they'll offer tinnitus assessments, and that can be used. We encourage the app is used in conjunction with them, but also clinics that offer some level of tinnitus therapy already. Then the app is a really good companion to that therapy. With the user going away and learning some exercises through the app, or having some objectives set with the clinician, with the audiologist. So yeah, in summary, it has its use case for both scenarios, and I think fits really nicely into both of those.
That's excellent. I'm happy to hear that, and especially because the users can access it in the evenings. Hearing a little feedback.
Absolutely,
right
yeah. So yeah, absolutely. They can use this whenever they want. So as opposed to with a therapist, if there's something like an exercise that they want to go through, they have to wait until the clinic appointment. With Otto, you can literally just open the app, scroll to the exercise that you want to practice, and Lily's voice or Lily will take you through the therapy, and it's that simple.
Yeah, that's wonderful. I want to share some perspectives here because I work with people and I get to see the individual change. And let's say someone develops sudden loud tinnitus. What I normally see, what my background normally prepares us for, is that the first 3 to 6 months, our main goal is reducing the percentage of time that we're aware of tinnitus and how much it irritates or annoys us or bothers us. So that's starting that habituation process. And then after that, the sound usually gets softer too, to some degree, and that's quite variable. So that whole time window can be between 6 and 18 months. And how do you guys approach that? And what do you see in terms of the rate of habituation or the rate of improvement over this long timeline? Now you've had about 9 months of data.
Yeah, so we've actually done we've done some initial research we've done a pilot study to understand the effectiveness of the app at 1 month and 3 months. So we measured a tinnitus function index, TFI, which is a validated questionnaire that assesses the impact of tinnitus on people's lives. We measured it in a group of people before they use the app. We let them use the app for a month, and we measured it again. And then we got them to use the app for another 2 months at the 3 month point, and we measured the TFI. And we actually found that after 1 month, 86% of users had a reduction in tinnitus. I think what you're referring to there was tinnitus severity, so the actual objective volume of the tinnitus. And that was sustained at 3 months. And at 3 months, there was at 1 month and 3 months, there was a significant improvement in the TFI scores. I think the average reduction was 12, and anything over, I think it's 7 is something clinically is deemed clinically significant. So from a data perspective, that's what we're seeing. And I think that what you describe, sort of that initial period of treatment being the focus being on just trying to get people to notice their tinnitus less, and that's what we do with the therapy program. That's what Lily has implemented, getting people to first understand that this is the aim, and then I suppose, because that's the first thing, isn't it? You've got to understand how the treatment works in order for it to be effective. And then, teaching people the skills that they need to be able to get to that. Once they've learned the skills, practicing them so the skills can actually have an effect. So, the 6 week sort of teaching period is the initial program, but then, we do encourage the users to continue practicing those techniques as their tinnitus improves.
Thank you. What apps or what technologies gentlemen were inspirations for you, right? Anytime we're creating a new technology, a new offering, a new service, we may model it after existing successful ventures. So what have you guys been excited about in either the mental health space, the audiology space, or something completely different?
Yeah, I think there's probably two elements to that. From an app perspective, Ed is actually, you're a big fan of Headspace, right, Ed? Ed spent months trying to convince me to sign up and join the Headspace gang. So I think just the way that you can essentially offload that wellness aspect of clinical medicine that doctors nowadays probably aren't very good at, right? Like listening and just giving people time and mindfulness, essentially. So being able to offload that into this kind of accessible digital therapy, as Headspace, Calm, a bunch of other similar apps have done, regimen stuff for IBS and IBD, sleep and stuff like that. So there's a big wave of this stuff coming out, and has been for the last few years. And me and Ed have always kept a close eye on it. And so, yeah, I've forgotten the next thing I was going to say. But yeah, I mean, there has been a whole sort of host of apps that we've been able to, draw inspiration from.
Thank you. Yeah, I've downloaded your app, and for anyone who's looking for it, you can find it in the App Store, OTO, Tinnitus or OTO, and it should come up. And you guys have a lot of great reviews. I want to pass it to you now as we're wrapping up. Again, this is an educational conversation. Hopefully someone who's listening may be interested in trying your app or another similar digital tinnitus health solution, because there are tools out there, and really that's all we care about, people getting the right tools. And you guys have put a lot of heart and time into creating this tool. Anything else you want to share about the journey creating this app, what you've learned, or where you think it can go? What's the potential of this? How many people can it reach, and what's going to be needed to get the message out there more and more?
Yeah, so that's a really interesting question. I suppose I'll start with the last part of that question. There's 400 million people with tinnitus worldwide, and our vision, our aim is to become the definitive solution for anyone with tinnitus. We want Otto to be that first step that people take when they have tinnitus. And that's something that's going to take us a bit of time, but it's a goal we're working towards. In terms of anything else to share, I would also we've talked very much about the user perspective and the consumer focus of the app, but we're also partnering, for any audiologists that are listening, we're partnering with clinics around the world. We already partnered with clinics here in the UK and clinics in the US, and we want to help audiologists deliver tinnitus management. We know that tinnitus is a big pain point for audiologists as well. We know that many don't feel like they are able to provide sufficient help, adequate help for people with tinnitus, and that's another problem we want to solve. We want to solve this for individuals with tinnitus that are struggling, but we also want to solve this for healthcare professionals that may be struggling to manage it. We know that here in the UK, GPs, they don't have much education. When George and I were at medical school, I don't think we had any education at all on tinnitus. So, we want to help healthcare professionals manage tinnitus as well. I don't know if there's anything you'd add to that.
No. I think that sums up nicely.
Thank you all. Any last words for our community before we wrap up?
Just say, thank you very much for listening. If you'd like to try the app, you can download it from the App Store, as Ben mentioned. You can try it for free for a week without paying. We'd love to hear what you think. If you'd like to get in touch, please just drop us an email. It's just hello@joinotto.com.
Thank you, Dr. Ed and Dr. George, for joining this episode of the podcast. Otto being one of my favorite tinnitus apps. It's great to hear the backstory and where you think this can go moving forward. So check it out. Check out the app, and remember that there are digital health solutions for tinnitus. All right, guys, see you in the next episode.